Welcome to A Small Dose of Hope Can Bring Us Together, a series on the COVID-19 vaccine as the rollout gears up here in Trinidad and Tobago and the region. I'm Francesca Hawkins. Our conversation this week takes us to Barbados, where our guest is the president of the Barbados Association of Medical Practitioners and co-chair of her organization's COVID-19 task force. Dr. Lynda Williams is a medical practitioner in general medicine, specializing in epidemiology, having graduated in medicine from the University of the West Indies, and holds a master's in epidemiology from the London School of Hygiene and Tropical Medicine. Dr. Williams is a highly accomplished doctor, medical administrator, and educator across the Barbados health sector. She's also held the position of clinical director of the Barbados National Cancer Study and played a crucial role in the establishment of the Barbados National Registry for Chronic Non-Communicable Diseases. She's been an associate lecturer in the Masters of Public Health at UWI. Dr. Williams has been a member of the Healthy Caribbean Coalition since 2011. Her list of achievements, well, they go on and on. This really is our honor to have Dr. Williams share with us her expertise and, of course, give us a regional point of view. It's very good to have you with us, Dr. Williams. Thank you very much.
Thank you. It is wonderful to be here. It's a real pleasure.
First of all, let's start. After several spikes and lockdowns, Barbados is now ahead of several Caribbean territories in its vaccine deployment plan. In terms of public health, Dr. Williams, what is the mood in Barbados at this time?
Well, we've just come out of 2 weeks of lockdown. We had weekend lockdowns as well as 2 weeks of strict lockdown. And before that, we had 2 further weeks. So it's about a month in all. We had a spike in the late December. And that spike in late December, early January is what led to the decision to lock down the country. So it's just been opening back up since this week. We have reopened certain sectors of the economy, but we're still under curfew. And there's still many public health rules to be followed. There's been no relaxation of those. As usual, once we have opened back a little bit, people take an inch and make a mile. And so we still have problems with people overcrowding in places. Wearing face masks is mandatory, but we still have to remind the population very often to continue to wear masks, to continue to practice physical distancing and hand sanitization. We still have clusters. It's mainly family clusters, and we still have many sporadic cases because we're in the phase of community transmission now. And so we're not out of the woods as yet. But the good thing is that we started our vaccination program, and to date we have done nearly 50,000 people vaccinated.
So with the vaccination rollout having begun, 50,000 people is a sizable number. You might be one of the most advanced in terms of your rollout in the Caribbean. What is the mood? What has that brought to the population, knowing that while things are still quite serious in terms of community spread, the vaccine is unfolding in tandem with those problems? Has that lifted the mood at all? Is there hope and more optimism amongst people?
Absolutely. Barbados has a very good record with vaccination in terms of uptake. Over the years, we have very strict rules about children being vaccinated for school, for college, etc. And our vaccine uptake has been fantastic. What's different this time has been the infodemic that has accompanied the COVID-19 pandemic. And so there was a lot of misinformation, and that needed to be overcome in quick time so that people could make a decision to take the vaccine.
Speaking of misinformation, can you identify now what might be the most important message your organization and, of course, public health has been promoting in Barbados over the past weeks in preparation for the rollout, and especially to overcome some of that misinformation that you're mentioning? What have you done?
So we have a task force that is very active. We have also assisted the government with the development of frequently asked questions brochures. We have created information for medical practitioners. We hold task force meetings for our medical practitioners because you had to get the medical practitioners sold on the vaccine first. And then they also will tell their patients, you know, we think it's a good thing, we think you can take it. So our organization is very active in holding online meetings for doctors, bringing all the experts together, getting everyone on board so that they could then take that message back to their individual practices. And, you know, it's because a lot of people call their doctor. They say, well, doc, are you going to take the vaccine? Are you going to use it? Tell me why I should and why I shouldn't. So those kinds of personal conversations with our patients, that has gone a long way. And we're also a part of the government's COVID communications unit. So I assist that unit also with creating messaging for
I'd like to ask you now, what observations can you share with us about the process of the rollout so far, the vaccine rollout, that is? What lessons have been learned? Any to share with us?
Yes. Well, the most important thing I would think that I could share is that we must have a plan, a schedule for the priority groups. Who needs to be vaccinated first, second, third, etc. So you must have a schedule and you must apply equity in the vaccine rollout, because obviously people have different barriers at first, but it must be, say, for example, you say you're going to get the over 70s vaccinated, the nursing homes, the healthcare workers. Those are our first priority. You must be able to reach each individual group with specific messaging. And I think that's a very important thing, to have a very clear schedule as to who gets rolled out first, second, third, etc. And you must have a method of registering people so that they can make appointments to come for the vaccine. And it's not a free-for-all, because you don't want to create lines and you don't want to create crowds at vaccine centers, which then become areas of transmission of the virus. So those things are very important, having that kind of detail in terms of rolling it out and letting people know what to expect and where to go.
Now let's turn to the AstraZeneca vaccine itself. Barbados now has comparatively more experience than, say, we do here in Trinidad and Tobago, with larger numbers having already taken this particular vaccine. Can you share with us what side effects you may be seeing, if any, across the population?
Well, the side effects we found were more experienced by younger people. So the older age groups had very few side effects, but the younger you were, the more likely you were to have side effects. And I always say to people, the side effects of vaccines show that your immune system is working, that the vaccine is doing what it's supposed to do. So the side effects are temporary, and they usually included things like arm pain and swelling, some mild fever, mild joint pain, mild muscle aches, general malaise for a couple of days, and some people had some swollen lymph nodes under the arm, and maybe some chills, and diarrhea and nausea in some cases. But, you know, within 24 to 48 hours, with the appropriate consumption of paracetamol, most people had complete resolution of those side effects. And we haven't had major side effects, anaphylaxis, and so on. Although we are prepared for that, and we prepared our population for that, and we were prepared at the vaccine centers to deal with anyone who had a major allergic reaction.
So you're saying, although so many people, comparatively 50,000 people in Barbados already vaccinated, the allergic reaction to the vaccine that has been a concern in the public mind, you've not seen any of this so far. Is that what you're saying?
very few, minor, one or two people who have multiple allergies. These are people who have an EpiPen. One or two people had some allergic type reactions, but we've had no major reactions, no hospitalizations, no deaths, nothing of this sort, nothing after 50,000 vaccines.
On a personal note, you would have taken the vaccine. What has been your own experience?
Absolutely. Well, it was interesting. I took the vaccine on the day that I was supposed to give a lecture here on the vaccine. And on that day, the day after, sorry, and on that day, I was feeling the malaise, the fever, and I also had a sore arm. The host of the program had also taken her vaccine the day before. And so when we came to the audience, because it was by Zoom, when we came to the audience, we said, look, we just had the vaccine and we're here. And the reason we're here is because you're that important. And it's an inconvenience, but it's temporary. And it's so much better than having COVID.
Thank you very much for sharing
temporary.
Your personal story there with us. Now, you did mention that Barbados is still not out of the woods. There is some community spread and clusters. You have already begun your rollout in tandem with that situation. Are you registering a drop in the infection rates, or is it just too early to tell?
It is too early because, I mean, although it's 50,000, we have a population of residents of 300,000, then we have non-residents, so maybe another 50 or 60,000. So, you know, 50,000 out of that is not really a significant enough number as yet to see whether or not there's a change in transmission. And as you know, having the vaccine doesn't mean that you are unable to transmit the virus. It means that you are less likely to transmit the virus. And that's what has been seen worldwide. But it's too early for us to tell what the effectiveness in terms of transmission and in terms of reduction of hospitalization and so forth.
So obviously your team will be monitoring and giving surveillance on the progress of the vaccination. Now, information is still unfolding about how long the vaccine's immunity will last. What can you tell us about this, and what is the Barbados health sector hoping to see on this particular topic?
Well, the hope right now is to be able to restore a level of normalcy, to get the kids back in school. I think that's really important for their mental health and for the parents' mental health as well. So we want to be able to see a greater uptake of the vaccines when we get our second set of vaccines, which is due very soon, in order to restore some normalcy to the country. The other thing that we're hoping to see is that we hope that the transmission among people here will decline. There's still a lot of people going between households, and we found that our households are where the majority of the transmission is occurring. And so within households and between closely knit households, that's where the most of the transmission is occurring. So if we can reduce that spread between households by people taking up the vaccine, that would be tremendous.
Now, this brings us to another point. Social distance and other pandemic protocols must continue even after immunization, something that at times, and as you mentioned, has been difficult to enforce. As a public health specialist, are you anticipating new challenges to maintain the protocols as the larger number of people are vaccinated and become perhaps more confident about their personal immunity? What plan might you have in place for that particular situation? Your thoughts?
Well, people need to understand that this vaccine is a disease-modifying vaccine as opposed to what we call a sterilizing vaccine. So you have things like MMR, polio, and things like tuberculosis and so on. And those types of vaccines that we would have had experience before, you were immunized, you may have gotten boosters some at other point in life, and it meant that you were now protected from those diseases for life. Those are sterilizing vaccines. But this vaccine is not like that. This is more like the flu shot that people get every year at particular intervals in order to prepare them for the flu season. So this is something that will have to happen over and over again. And we don't want people to get to the place where we feel, oh, we have the vaccine, and therefore now we can just take off masks and do everything as usual. Because we're not yet at the place where sufficient people in the society have the vaccine that we can reduce transmission. We're not at that herd immunity place where we have the numbers of people vaccinated in society that transmission rates have dropped so significantly. And so those social protocols, those public health protocols still have to continue. I think with reinforcement of the messaging and, with reinforcement of the reasons why they're put into place, we will continue to follow the rules. And Barbadians have been very good to some extent at following the rules. It's just certain sectors of the society that we need to work more closely on, the youth in particular.
So intense communication of the COVID-19 protocols will continue. You're watching A Small Dose of Hope here on CNC3. It can bring us together. It's a series about the COVID-19 vaccine presented by the ANSA McAL Group. Each week, we speak with international and Caribbean scientists, medical specialists, and thought leaders about the new vaccination stage of the pandemic. From Barbados to share her expertise is Dr. Lynda Williams. Now, information and misinformation circulating globally has led to public skepticism about the new vaccine. Now, as president of the Barbados Association of Medical Practitioners and being the co-chair of the organization's COVID-19 task force, Dr. Williams, what approach did your team take in terms of dealing with this kind of confusion?
The most important thing when you're dealing with misinformation is to present truth as an alternative. So one of the biggest areas of misinformation is, why was this vaccine developed so quickly? Is it a part of a plan? Was the virus deliberately released? And so, going after the origins of the virus, explaining how we were anticipating a pandemic of this nature for many years in public health. For many years, epidemiologists were expecting to see such a pandemic happen. And the changes in technology and the need for an emergency use meant that the 10 to 15 years that a vaccine would normally be in development were able to be cut down very quickly. Because we have more advanced technologies and because these are different types of vaccines from what we are traditionally accustomed to. So the question shouldn't be, why is this so short? But why did it used to take so long? And the reasons why now we have gotten shorter and shorter times is because we were anticipating it. The virus was close to a virus that the world already experienced in SARS. And the genomic sequencing and the preparation for the technology was already in place. So that all happened very quickly. So much so that between December 2019 and February 2020, the companies that make vaccines were already in preparation for trying the new, for going into starting and preparing for clinical trials.
How do you see the coming months unfolding both in Barbados and across the region, especially in terms of vaccine availability?
This has become an area of great concern worldwide. I think all of us would have heard the director of the WHO saying that, it's a great challenge for countries to receive equity where getting the vaccine is concerned. It's not a simple thing for small island developing states such as ours to be able to compete on a global market for a limited supply of vaccine. Yes, everyone in the countries of the world signed up for the COVAX facility, which is from the WHO, to ensure equal distribution. But then many countries went and formed their own deals with the vaccine companies to get enough vaccine for their entire population. So that meant that the smaller the country, the less negotiating power, it becomes difficult. We were fortunate and blessed to have received a gift of 100,000 vaccines from the government of India, where the AstraZeneca vaccine is being produced. It's one of the sites that they use in Serum Institute of India, one of the largest vaccine producers in the world. And they gave 100,000 vaccines to Barbados. And we shared some of ours with other Caribbean territories. And that which we had was enough to do this initial rollout. And we're currently awaiting the second phase of vaccination, which would be from the COVAX facility. But getting that equitable distribution between countries is one of the greatest challenges that we have right now.
Now, as you mentioned, Barbados was able to secure vaccines from India from more than one source, while some other nations staying more closely to the WHO's own COVAX facility. What are your thoughts on the two approaches for the Caribbean, the two approaches?
I think recognizing that the vaccine could offer hope, I think that we were right to go after getting the vaccine by approaching the government of India. I think we're also right by being a part of COVAX and being able to contribute to COVAX and to be able to receive some of our vaccines through that facility as well. But, we are a tourism-dependent economy. Almost everything in Barbados has some link, some connection, some direct involvement with tourism. When tourists can't come, when we have community transmission, when our numbers drop by 90%, our economy is in free fall. We had to do something, and therefore our Prime Minister took the step to do something right away to help the economy and to help the people who are suffering, who are without work, and who cannot go forward unless they have some form of employment soon and they are protected. So I think both approaches were worthwhile. And as I said, we receiving those vaccines put a different spin on things. We know it's not the one-time disease sterilizing, but at least there is hope that we can at least bring back our economy, which is the chief thing.
As you mentioned, tourism, very much at the center of the Barbados economy, as it is for much of the Caribbean. Give us your view on the impact of the vaccine in that sector's short to medium term. How hopeful are you that the vaccine route will quickly bring the sector back on its feet?
Well, we prioritized our tourism industry workers as frontline workers. So it wasn't just healthcare workers that got the vaccine up front. It was all frontline workers. So people in the tourism sector, as well as healthcare workers, as well as people in the supermarkets, the banks, the gas stations, and so on, they all received the vaccine in this first rollout. And the reason for that is we hope to be able to have a scenario where we're able to welcome back tourists in a safe way. You're still going to need to be tested. You're still going to need to come in and perhaps have a shorter quarantine through having received both doses of vaccination overseas. So, having vaccinations means that sector can be protected. And so the transmission from people who are coming into the country to the population is reduced. So yes, it has given our tourism sector the hope of restarting.
And of course, by extension, with that policy, you're suggesting that across the entire region, that the vaccine could quickly hasten a return to the tourism sector. Now, Doctor, you've worked extensively in the non-communicable diseases. You played an important role in establishing your island's national registry. Now, do tell us, diseases such as diabetes, obesity, heart disease, these are the very comorbidities that put people at the very high risk spectrum for severe disease and death from COVID-19. I heard figures just today, new data suggesting that up to 90% of people who have died globally have been obese. Now, in the face of the virus, more important than ever that we adopt healthier lifestyles. With your particular expertise in that sphere, What advice can you give here? Because obesity is a Caribbean-wide problem. So on a very one-to-one level, what can you tell members of our audience who may be saying to themselves, well, look, I am quite overweight. What do you think they should do right now?
One of the consequences of COVID-19 is its direct impacts, but also its indirect impact on non-communicable diseases. On average, people gained between 6 and 11 pounds, and that's just in the lockdown periods that their countries had. So even just by not moving as much, okay, and eating more, being at home, you tend to eat more. And people tended, when the fast food restaurants opened, I don't know about in Trinidad, but in Barbados, they would rush to the fast food restaurants as if they had missed a long lost friend. And all of these things contribute to obesity. So diet and lack of exercise. Also, it was much more difficult to source fresh fruits and vegetables during periods of lockdown. And it was because, you know, they were less available. You had to go to the supermarkets during limited periods. And so all of these things have contributed. We already were suffering from an obesity epidemic. About 50% of women over the age of 50 in Barbados are overweight or obese. And so that's a pretty high number for our women especially. But throughout the Caribbean, between obesity, diabetes, and hypertension, if you're over the age of 50, there is a 60 to 70% chance that you have one of these. And so our region needs to be very careful. We need to make lifestyle choices, particularly during this COVID-19 pandemic, that are not going to expose us to having a greater risk of death from COVID-19.
Dr. Williams, thank you very much. As we approach the end of our time together, share with us your closing words, please.
I would encourage everyone who is listening to really consider what taking the vaccine for against COVID-19 can do for you as an individual and for the country as a whole. What we've told people is take the vaccine not only for yourself, but for those around you. If we can reach a place where sufficient people have taken the vaccine, that even those who haven't taken it are also protected because transmission is reduced, then that's a dose of hope. And our countries can return to a normal state, hopefully, in the very near future.
From Barbados, we thank you very much, Dr. Lynda Williams. It's been a small dose of hope can bring us together, presented by the ANSA McAL Group here on CNC3 with a new episode each week. We continue to talk about the new COVID-19 vaccine with a wide range of medical experts, scientists and public health leaders internationally, regionally, and from right here at home in Trinidad and Tobago. Thank you very much. See you next time.